That's why it's need to do near device. So you just take the patient, cut it. The earring automatically, because of high pressure inside the artery, the blood will come by themselves. You need more than a little bit, 1 milliliter. Then you took it and put to the device. Device have special place for the earring. You put there, and then in I think 65 seconds, you have a result of all gases in the blood. And then you can see he have hypoxia, he have hypoxemia, hypercapnia, or hypocapnia. Hypocapnia. It means that it's when it's low CO2. When CO2 is high, it's hypercapnia. When O2 is low, it's hypoxia. When it's in the middle, hypoxemia.
This instrument name?
Huh?
Instrument name?
Too many names?
Instrument name. Instrument name.
Instrument name. Blood gas machine. Just. Gas machine. Okay? And then at home, mark that you need to read about this. What's the normal range in the blood gas machine? O2, CO2, PO2, and pH. When you will say that it's alkalosis, when you will say it's
acidosis.
No, for us now we important four things, because for each diseases I will give the examples of these results. Okay? Next. Pleural fluid. So when we have pleural fluid, it can divide it for two. It's an exudate and transudate. Exudated and transudate. We have two types of water inside the lungs. Transudate and exudate. And you need to know what is exudate, what is transudate. Then X-ray. I think everybody knows about X-ray. And usually when we see the lungs, what kind of X-ray we do it? Anterior and posterior. Two shots. From here and from here. And then we can find atypical. Because when you're doing anterior, usually it's very difficult to see the pleural fluid. If you do it like this, it's easier to see.
So both sides?
Both sides. It's need to do both sides. And after X-ray, by the time, we have a lot of innovation. And now we have CT scan. CT scan. What's the difference between X-ray and CT scan? Who can say?
CT scan is more clear.
Why? Because when we're doing X-ray, who know who is first do the X-ray in the world? How the name of the research? Röntgen. It's Röntgen. It's German guy. So when we're doing Röntgen or X-ray, if the American peoples don't like, so as you know, Americans love to say that the best peoples in the world, they do all innovation. That's why in America they don't use the names, because when they say Röntgen, for example, we say we need. I say to the patient, you need to do Röntgen. In America, you will never heard that he will say need to do Röntgen, because for them it's very bad that don't Americans found the X-ray. That Röntgen was very famous science, and he was not American. That's why they said X-ray. Röntgen, it's using in Europe and in our countries. So the X-ray X-ray, it's a picture. The X-rays, sunshine, well, not sunshine, the shines, going through the lungs. And behind the lungs, so when you're doing X-ray, you're standing like this, and behind you, it's a flat thing, and then the shines of the X-ray going through the body, and fix it on the plate of this here, okay? And then when the shines going through the lungs, they showing what they, it depends of the pressure of the tissue of the lungs, it's showing the color on the picture, okay? It's a simple photo, what's going through the lungs in one place. The X-ray, it's working like this, but CT, when you're doing the CT, the patient going inside the round thing,
Yes.
and then this round thing going every time rounding and going through the patient. And then it's showing not like picture through the lung, it's showing from up to down every 5 millimeters. You see? And then it's when it's from going from the up. I'm not good like a Picasso, so you need to understand. This is a ribs. This is a lung parenchyma. This is a mediastinum. If you will look from up to down, okay? So if I have this, so you will see like this, and it will show every 5 millimeter picture. That's why it's very accurate. You understand?
Yes, sir.
Everybody understand how it's working?
Yes, sir.
Every 5 millimeter of the lung tissue is showing. Every 5 millimeter of mediastinum. Every 5 millimeter of the ribs. And going. So if patient like that, 5 millimeter, 5 millimeter, 5 millimeter, 5 millimeter, 5 millimeter, until the up until down. Okay?
Yes.
This is a CT. And also plus of CT, it's showing where is it, how long is it, how is big, and what kind of tissue, strong, small, empty, water inside. We can analyze everything because it's showing every 5 millimeter slice. And then that's why every year we found more pulmonary fibrosis, we found more cancers because we have now CT. But in now 2019, with all this equipment, we have a strong, no, we have evidence. We have a specified and filified. Specifičnost и точно, like how to say, it's two things. For example, ECG, it's very sensitive, sensitive and specified and sensitive. Sensitive, it means that it sense every abnormals, and specified, it means that it's abnormals showing that is this diseases. Specified. So each diseases have something what is showing that it's these diseases. For example, ECG of the heart, it's very sensitive. ECG will detect any abnormalities of the heart. It's sensitive. But how is it again? Specified is not good because this he can what's like sensitive and specified. So ECG sensitive 100%. He detect everything, but specified 50% because he can sense that is working not good, but can understand just in 50% you can understand why.
Yes, sir.
Okay? Now CT scan. Sensitive 90%. It's a big research was in all America and Europe. 5 years they researched this. And specified 88%. But you can say it's very big percent. Let's say thromboembolism. Thromboembolism. When the thrombus going to the lungs, usually 80% patient will die, but 20% can live after. Then thromboembolism we can confirm by CT. And CT sensitive 90% and specific 88%. High percent. How do you think? It's high?
Yes, sir.
It's high. Now let's take 100 patients. 100 patients admit to the ambulance and doctor said, we think that he have a thromboembolism. Let's do CT faster. And like this coming 100 patients. And then from this 100 patient, 90 patients or 88 patients will confirm my diagnosis. 10 patients, 12 patients. Right? How do you think? It's big number.
No.
Who will not detect the pulmonary embolism?
Yes, sir.
It's very high.
Yes.
It's a mortality diseases.
Yes, sir.
So 10 patients will die because of wrong,
Detection.
no, not wrong report. From 100 patients, 10 patients will receive that you have no thromboembolism. Then they will go to home and die. You understand?
Yes, sir.
Yes, sir.
It's me that we are already in very urban IT technology world, but still we miss a lot of numbers. In one day, in the world can be 10,000 cases of pulmonary embolism in one day. It means that in one day, 1,000 people have wrong report. And this study was in America and Europe, where they have very good specialized, very professional CT scanners and very expensive and modern equipment. If we will come to our countries, Kurdistan, Pakistan, this percent will be lower x2. You see, that's why important to know to have a very good education. How many populations of Pakistan? 21 million.
No, sir. 220.
220 million.
Yes, sir.
So 220 million. Let's say usually 35% of all population of the country is children. In any case. So it means that 150 million adults. From 150 million adults, we have 100 million, well, not 100, maybe 85 million youngs who have no reason for pulmonary embolia. And it means that you have around 75 million patients who are in the risk group of pulmonary embolism. 75 million people in your country. It means from the 75 millions, how many people will have detect wrong report?
3 or 4.
1 million.
7.5 million. 10%. So it's big number. So and that's why if you see this percent, it's not mean that it's good. Okay? Everybody understand that?
Yes, sir.
Yes, sir.
Okay.
Yes. सुनिएगा 70 लाख बंदा बीमार करते
मशीन बनाने जो 100% रिपोर्ट
7 करोड़ बंदा
Okay. Going next. Next is a ventilation perfusion scan. But I already know that in Kyrgyzstan and Pakistan you don't have it. I know that they have a special laboratory in India, one device. In Europe they working as usual. Ventilation perfusion scan. It's very easy things, but for like also some kind of X-ray. But usually they use nuclear power. It's need to have a nuclear system, like a bomb inside the laboratory to have this test. But it's very sensitive and very specified test. Next, very easy thing, ultrasound. Ultrasound, yes. But lungs, so we can do ultrasound just of pleural. Because ultrasound detects the effusion better than X-ray. So if you have a effusion more than 300 milliliters, you will see this in X-ray. But if you have a less than 300 milliliters, you will never see this in X-ray. You will see it just in ultrasound. Ultrasound already can detect the water inside the lungs when it's more than 100 milliliters. And just CT scan can detect effusion more than 50 milliliters. Okay? So for example, patients in beginning stage of tuberculosis usually have a 200 milliliters. Then that way you will not see it in X-ray. Patient said, I have fever sometimes, I have cough and pain here. You're doing percussion, it's okay, because 200 milliliters, you will never also detect it. 200 here, 100 here, 100 here, you will never detect it by percussion. It also will very good sound. By auscultation, you will never hear that. Then you say, maybe X-ray. You're doing X-ray, X-ray don't detect the water. And then, if you see the habitus, the lymph nodes is big, and all symptoms is okay, you need to check ultrasound of the pleura. And then in pleura, say we detect 200 milliliters of water, then you will punch to the pleural fluid and go to the bacterial laboratory. And then they say you have tuberculosis. Okay? Yes, sir. So bronchoscopy, you will read it at home. No time for that. Oximetry also no. So I will explain. So I told about blood gas. What is this? You know now. You can understand what is this about CT, X-ray. And main thing is lung function. Yes.
Lung function.
Spirometry. It's more than half of diseases of the lungs will confirmation with this test, because lungs it's a pump, the bronchus is a pipes, and then they produce the spirometry test, and this test will show you do you have patient obstruction or restriction. And what you must to know about spirometry, it's what kind of things it show for you. Spirometry doing in any age, but just in the adults who already understand the maneuvers. For example, it's starting from 7, because it's 6-year-old children will not do that. Where is the spirometry?
Class तो बहुत पूछा
What? No, we'll finish with spirometry. We until 12 we'll be here.
Yes, sir. कितने गया यार
6 घंटे की क्लास है नी 6 घंटे की 2 बजे तक नहीं वैसे टाइम तो पता नहीं लगा है
So, first what we will found in spirometry is FBC. Yes.
Four.
Four step.
forced
Vital
vital
capacity.
capacity
It's a first thing what we will say. So it means that how many air will go inside your lungs. Second thing, T1. Forced expiratory volume in 1 second.
expiratory volume in 1 second
Forced expiratory
volume
volume
in 1 second
in
1 second
1 second.
Second thing and third, it's a FBC
साला तो यहाँ रवे है
B1 ratio.
तब भी कोई नहीं जाने
So it means that PVC will show
How much air go inside?
how much air.
Go inside your lungs.
Yes. And P1.
How much air go outside?
Huh?
ratio
Ratio, yes, ratio. P1 will show how many air will go out from the lungs in 1 second. Because when you're doing spirometry, you take the device, you put the mouthpiece to the mouth, then you go in up to detect, and then blow out. And it's detect how many all air go out and how many go out from the in 1 second. If you have a very good bronchus inside the lungs, if your bronch is open, okay, it will be 100%. The P1. If your bronchus, for example, if you have asthma,
फ्रांसिस्को कुर्बानी देते करा देगा फ्रांसिस्को अल्लाह करे
you will have P1, for example, 50%. And you will detect it by P1. Okay? And ratio. Ratio, it's showing do you have obstruction or do you have restriction. This ratio is compare the how many air inside and how many air go out in 1 second. And you need to remember for all your life, if PVC P1 is 0.7 and more, you have no obstruction. This means that bronchus is open. It means that if you have result of
0.7 or more?
yes and more, if you have result of spirometry and you see that ratio is more than 0.7, you can forget about COPD.
0.1
0.7
0.7. and more.
0.7.
It's if it's 0.7
7.
or no COPD,
प्लस 7 है ना
no abstract. But
तुम ही सही समझे
if you see that this one is 0. For example 5, it means that he had abstraction, and then how it's severely abstracted, you will calculate by P1. If it's if it's
68%.
सर तेरी बज रही है सर जी ना D1G
उस्ताद काफी तरह बज दिया है
I just how it's remember. If you, for example, see that ratio is 0.5, you're already thinking about abstraction. Then you're looking to result of P1. And if it's between 60, 70, as I remember, it's a first degree, 46 is a second degree, and less than 40 is third degree. It means that you have middle,
even.
moderate, and severe abstraction. It's a when you we will talk about when we have COPD. I just tell you that what will show you spirometry. Okay?
So can you show this instrument?
Yes, but not now. I will show. It's small. Now it's a very small. Before, I think 20 years ago, the spirometer will take all this room, but now it's like this.
छोटी हो गया बंदा नहीं छोटा हो गया
बंदे नहीं बुढ़िया जानी
बंदे छोटे हो गए
या ना पेली
अच्छा आज कुछ बात नहीं पढ़ा रहे
I also tired. Okay, so class silent. So this for you. We'll bring next time. Ask them. So, and to the next lesson, we will, I think, start with already diseases. But before the start diseases, we again will repeat the examination of the patients. So all of you need to know from where we start, what we need to do. The next step will be, I will give you for the patient have pneumonia. What you will do? You need to say blood gas, X-ray, spirometry we need or no? No. In infection diseases we don't do spirometry. Then ultrasound or no? So I will ask about instrumental things. And then if you will answer that, we will continue with diseases. Okay? Yes. So but please put all things very good without garbage.
PDF फाइल दे देना